If you give Narcan to someone who does not need it, it will not hurt them. I've done it to myself, and all you feel is that nasty drip in the back of your throat. No head change, no heart rate change, nothing like that, just that nasty goop down. Even if you were to give me 4 or 5 Narcans and I didn't need it, it would not hurt me, okay? So don't worry if they're maybe having a heart attack or something else where you're seeing them look blue. It is not going to do anything to hurt that person. After they start to come around, when they start to come around, people are going to wake up different ways, right? Confused, maybe mad, dizzy, disorientated. So just kind of give 2 steps back so they have a little space to breathe, and then explain to them what happened. They very well may not be a happy camper, and this is why. The way that Narcan works is it kicks off all the opiates off the receptors in your brain. So the receptors is what makes it feel good for the opiates to be in your body. That's where you get that pleasure feeling, right? And the Narcan comes in and it kicks all of the opiate off the receptor and it binds to it. So the opiate is still in your body, but it's no longer being able to attach to the brain. So this only lasts about 90 minutes, and then it starts to wear off. So if that person still has a lot of opiates in their brain, when this Narcan wears off, they're going to overdose again. Narcan makes people feel terrible because when all those opiates are kicked off the brain, it causes physical problems, right? So people have described it to me as the worst flu they've ever had, vomiting, the shakes, just feeling absolutely terrible. And so if you're feeling terrible and you know that the opiate is going to make you feel better, you are going to want to use it as soon as possible, right? But if they use it, 2 things can happen. 1, they are not going to feel that drug. Doesn't matter how much you use, it cannot get the Narcan opiates off the receptors. The only thing that can do that is time. So usually that's a good one that people are like, oh, okay, I'm wasting my drug. Right, not gonna do that, right? The second reason is because all those opiates that are still in your brain, once that Narcan wears off and they can attach to the receptors, if there's too many opiates in their body, they will overdose again. So we always really encourage people to go with EMS. If they're really adamant about not going with EMS, which we see a lot, see if they can call a friend to have a friend stay with them. You stay with them as long as you can, because you want to make sure they're not going back into that overdose. So someone is there with them. If they become unconscious again, they can get help. A lot of people are going to feel really nauseous, so water is great. A little bit of small food is great. It's going to take them a little while to get their bearings again. But yeah, people ask me all the time, is water and food okay afterwards? Yes, it is. The Good Samaritan Law protects people from using Narcan or doing CPR on someone. So if someone gets hurt, you are not liable at all. Narcan is completely legal to carry. I've had people ask me that if like police officers or somebody else sees Narcan in their car, are they going to assume that I use drugs? And the answer is no. We have never had that problem. So just because you have it doesn't mean that they are going to search you. Narcan has an expiration date. It's going to be on the top of the box that you get. It's a 2-year expiration date. All Narcan is good Narcan. All Narcan is good Narcan. Even if it's expired, there are still active chemicals in there it's still gonna work. It's not gonna be as potent, right? But it's still going to work. You should also not store Narcan in places that have extreme temperature variance. So like your car, that's not the best place to put it. But again, if that is the only place you have to put it, all Narcan is good Narcan. I keep mine in a little pouch that I attach to my purse, so I never have to worry about where it is. But again, wherever is good for you. If the car is the only place that's good for you, great. All Narcan is better than no Narcan. Trying to think if I've missed anything here. Nope, I think I covered it. What questions can I answer? I know that's a whole lot.
Yes, we do this a lot, and thank you. I think some joined while you were talking, but I just want to tell them, just write your name on the chat, your phone, your zip code, your age. If you don't want to put it up here, just text it to me. I put my phone on the chat, but my question is, can you explain what's overdose? You know, some of us maybe we don't understand what's overdose.
Yeah, sure. Overdose is when someone takes too many opiates, and those opiates keep people from being able to breathe. Opiates can look look like a lot of things. So like the pain pills you get from your doctor can look like pain or pills that you buy on the street, can look like heroin, any kind of opiate you can overdose on, including your prescription. If you take too many of your prescription pain meds, you can also overdose. Even if the substance does not have fentanyl in it and you take too many, you will overdose. Now, the overdose will not be as strong as if there were fentanyl in the product, but you will still experience that overdose. So I see sometimes people who took their medication and accidentally forgot that they took it and took another one, and depending on your tolerance level, you may have an overdose. It's all dependent on that person's body. Everyone has a different tolerance level, and it affects everyone differently. So if a person forgets and they take that prescription drug again, very well may be fine. If someone else takes it, doubles up, they might not be okay. It just depends on your personal body chemistry.
Okay, I think I got one more. So, so when you overdosing, what happens to your body? What happens? What's the reaction on your brain? Like, what's going on you?
So when too many receptors are bound to, it tells your brain to slow down your breathing. And once your breathing slows down, it can stop. So people, you start the overdose, they hit the ground, their breathing is struggling. The next thing that happens is they are going to stop breathing. When they stop breathing, their heart is going to stop. And so that's kind of that progression through what it looks like once you have that overdose. And that's why before you give Narcan to somebody, you want to check for those signs and symptoms, because you can still see some of that. Like, that is a normal effect of opiates. It is normal to make people sleepy. It is normal, you know, for people to have that reaction, or you call their name, they don't hear you, you yell their name and they're like, oh, what, you know, what were you saying? It's not unusual for people to nod out. So it's not unusual to see people asleep when they're using opiates, because that is the effect of opiates. It is a sedative, kind of like a closest way I can explain it is like a sleeping pill. And so once there's too many and their breathing slows, it eventually will stop or get to the point where they really need assistance. So think about like 10 breaths per minute, really low. If they're breathing that slow, they're definitely not getting the oxygen level that they need. And then once the Narcan pulls all the opiates off the receptors, they immediately start breathing again. So Narcan isn't immediate, but when it does their job, they're gonna immediately sit up. They're gonna start breathing. It's all about those receptors and how many of the opiates are bound to them, because that's really what causes people to stop breathing.
All right, that's a good explanation. So I learned a lot. So I didn't even know what happens when you overdose in your body. But is there anyone questions questions? قبل سؤال قوي مجرى. And anybody want to ask questions? Anybody miss something? Can you go back one more time how to use the Narcan? Just show us one more time.
Yeah, how to use the Narcan?
Yeah.
Question.
Sure. So in the box people will be getting has 2 doses of Narcan. They look like this. They just have this peel on the back here that you just peel to open. Each one is 1 full dose. So you're pulling it out of the package, it's gonna look like this. So then you're gonna stick it up the person's nose, doesn't matter if they're breathing or not, it will still work. It's going to go up the nostril like that until the base of your fingertips are touching the base of the nose. So all the way up. Then you're gonna hit this plunger. Do not put your finger on the plunger till it's in the nose because you could accidentally set it off. So hit the plunger, it's gonna go up like that instead of hanging off at the bottom. That's how you know you've used it. It only has 1 spray. So now that you've sprayed this is trash. And there are 2 in that box. You have to wait, since it's not instant, you have to wait 2 to 3 minutes before giving the other dose. And there are 2 in each box.
Okay. Thank you. Someone has a question. Go ahead, please.
I have a question.
Sure.
Can you hear me? Oh, yeah.
Yes.
So about the signs of the person who's overdose, like the person, you said the person is gonna stop breathing. So probably I found somebody on the ground flat and not breathing. So how would I know this is, overdose, or, it's something else,
Great question. So signs of overdose can also be similar to other medical emergencies that folks could be having. So the signs you're looking for in terms of overdose is very small pupils, blue lips, blue fingertips, very pale for people who are white, ashier skin for folks who have melanin. Now, if that person is not having an overdose, but it looks like they are, you can still give that person Narcan because it will not hurt that person. So if they're having a heart attack and you give them Narcan, it will do absolutely no damage. So it's a great question because some of the things can overlap, right? Other things that could cause people to not be breathing. And so better safe than sorry, since the Narcan will not hurt anybody, to go ahead and give it, just in case it is that overdose, and if it's not, that person's going to be fine.
Okay, thank you. One more question.
Yeah.
So in case I help the person and then and probably he wakes up very fast and he just came back to normal, do I have to still wait for the emergency to come, or I can just leave?
No, if they are awake and they have come to and they are breathing, you do not need to wait, because this medication does not wear off for an hour and a half. So you know that for an hour and a half, this person is okay. So at that point, that needs to be on either them or a friend or anybody else. So I would always encourage them to call a friend, family member, have someone come pick them up so that that person can watch them after that hour and a half to see if they're going to overdose again. But once that person is awake, even if EMS is not there, then you can go ahead and leave that situation.
Okay, in this situation, I was helping this person and the person died, and the police came. So do I have still to explain, that until that case, becomes clear, like if I'll be needed to go to the court or something, to verify?
The only thing that you would do in that case is tell them, I gave them Narcan. This is how much I gave them. I found them not breathing, or I found them, don't know how long they've been there, just the very basic information. You will never get in trouble or get called into the police station or anything like that, even if there is a death. You're just going to answer the basic questions of this is when I saw them, this is what happened, this is what I did, and that's the end of it.
Thank you.
You're welcome.
Question.
Mm-hmm.
Can kids overdose on medication? If yes, is Narcan safe for them?
Yes, kids can overdose on that medication. Last week, I met a 16-year-old who bought an opiate from a friend. He was being as safe as he could have been, got it from a friend, only took half and swallowed it. If you're gonna do a drug, that is the best way to do it, because you can always put more of that drug in your body, but you can never take it out. And he was given Narcan. He is totally fine now, a little scared and shaken up, but he is totally fine. We met his mom. They have more Narcan. We gave them Narcan for his friends, because, you know, people are going to do what they're going to do. So at least he could help keep his friends safe. And yes, Narcan is totally fine for anybody. You can also use Narcan on dogs. If your dog eats your pain pill, you can actually use Narcan on dogs. How many doses it's going to take, could not begin to tell you, but you can bring it back with Narcan.
Thank you.
You're welcome.
One more question.
Yeah.
You say 2 Narcan, 2 breath. So the breath is like you give the person like mouth to mouth, like you're gonna breathe direct to his mouth?
Yes, mouth to mouth, 2 breaths every 5 seconds. Now, if you are not comfortable with that, I understand. It is a pandemic. Just getting that Narcan in their nose will absolutely help. But the breaths are really what's going to keep that brain alive. And so sometimes people can come back, right, but they're brain dead because their brain didn't get any oxygen. So getting that oxygen to them, other than using the Narcan, is the most important thing. So if you're not comfortable, but somebody else is, having that person do the mouth to mouth. Now, if that person knows full CPR and that person's heart isn't beating, they can absolutely do that. I am just not CPR certified to train, so I'm not allowed to explain those steps. But for those who know how to do that, or if EMS indicates that they do that, they'll walk you through it.
All right, thank you.
You're welcome.
Let's see. We got at least, let's see what time it is. So let's have 1 more minute and then we can end this. Anybody else with a question? And then we can end it.
One thing I would like to add is that typically police come with EMS to make the scene safe, right? If you have a personal amount of drugs on you, that person does. If they have a syringe on them, if they have warrants, that person should not be going to jail. They will take that stuff, but they should not be running those people's names. And the reason they do that is because if they do that, people are going to stop calling 911. And so LMPD is really, really good at just leaving that person alone. So even if you as the responder have something on you, whatever that may be, they are not going to ask to search you or anything like that. And 9 times out of 10, they're just gonna take, if that person has stuff, they're just gonna confiscate it. And if they typically do not confiscate Narcan. Every once in a while we get someone who doesn't know, you know, but there also should be not confiscating Narcan.
Wow, I didn't know that. I think that was a good training, and thank you, Elena, for doing this. We do appreciate it for your help and the training. I think we're about to end it. Anybody with questions, I'll do it again. One more time, just write your name, your zip code, and your age. If you don't want to type it up here, just text it to me. I'll text my phone number, take it, because we're trying to get some information. Okay. So number kayo mas usual. Also send me your full name so I can give you a certification that you took the training with us.
Thank you guys for doing this so late. I really appreciate it. If you know anybody that needs Narcan training, if you want me to come back, if you want to host one, great. Anything that you need, just let me know. I obviously work weekends and nights, so I can make anything work.
All right. Thank you, Elena. I mean, thank you so much for giving us your time, especially on the
Absolutely.
weekend. But that's it. So we'll, oh, here we go. All right. Thank you all. All right. So I'll send you those information, the zip codes, just to have a database. But I think that's it. Adam Masintin Kafal, but thank you so much for those who come in and to this class. See you guys maybe for the next training, maybe something else. All right. Thank you. Bye.
Have a good weekend.
You too.